I'd like to welcome you, sir, to this episode of our podcast. And today we'll try to talk about your journey, which the topic is about mending faces, shaping futures, the journey of a pediatric cranial maxillofacial surgeon. Uh, my name is Yahuza Haruna. I'm a 500 level medical student in Bahrain University, Kano, and I'm the host of this podcast. So, sir, we would like you to briefly introduce yourself.
Thank you very much. I'm deeply grateful for having me here. My name is Amole Ibiyinka Omishola. Amole being the son.
Okay. Thank you very much for the brief introduction. Now, sir, please would like you to kind of give us what were the early motivations that push you to choose a profession in pediatric cranial maxillofacial surgery?
It all started from the impact some people had on me from my background. Okay, I got exposed to dentistry. Okay, as a normal man on the street, because my uncles, two of them were dentists. One was an oral and maxillofacial surgeon, and the other was an oral pathologist. I was interested in oral maxillofacial surgery because I thought it was something I could do that would give me fulfillment outside of money. You understand what I'm saying? Outside of money. So I worked in their clinic for quite a while, so I was able to get exposed to the things they were doing. And that's where my interest grew. I enrolled in dental school at the University College Hospital, Ibadan, spent 6 years there, and I finished it.
Oh, that's great, sir.
Yeah.
That's great, sir. Now, sir, we would like you to kind of like take us through this course is a kind of very challenging course. Can you briefly take us some of the milestones, like the challenges specifically? You've actually passed so many milestones, but the specific milestone from the undergraduate through the postgraduate that people could know.
Okay.
And
I wanted to tell you that when you say the profession is challenging, what are you talking about? Dentistry, maxillofacial surgery, or pediatric craniofacial surgery?
Okay. In general, dentistry is challenging as we know as undergraduate, and looking to the bigger picture also, maxillofacial surgery. I don't know much about it, but I used to hear that it's very challenging. So I would like you to briefly talk like the dentistry itself, because most of our audience are undergraduate people. Then also the part of maxillofacial surgery, because some people want to pursue it.
Okay, so dentistry is a 6-year course at the University College Hospital, Ibadan. And I think it is the same in every other hospital in Nigeria. Okay, starts as a dental school, year 1, year 2, year 3. Now you know that dentistry is very, very expensive. It's much more expensive than medicine. Why? It takes almost 4 times what it takes to train a medical student, to train a dental student, because of all the hardwares that you need, the dental chair, the hand pieces, all those things are a lot of money. And they get exposed to treating patients very early. I think the 400 level, they start treating patients.
Yes.
And so, first of all, that was the first obstacle we had. There were no equipment. Northern Nigeria is blessed. When I see what they have, Phantom had me 2050 in Ibadan, we had only 3, and 3 were malfunctioning. Damn. Okay? We had to pray and fast that they would bring these things to us. And then when we finally brought it, that was the first challenge. The second challenge was how to get your personal equipment. Schools are supposed to give you personal equipment. Okay? But at that time, the school had no funds. So we had to procure our own equipment, procure your own syringes, dental handpieces and all that. That's a lot of money, a lot of weight on it. And then when I got to the postgraduate aspect of oral maxillofacial surgery, it's very challenging. The calls were very hectic. I rotated in so many specialties, including plastic and neurosurgery, and all that. You meet a lot of seniors who are telling you are not ready if you are failing.
It's true, sir.
And then I started failing exams at that time. I failed like 4 times, but I stuck to my guns because that was all I wanted. And I finally passed. I passed without being attached to any institution. I passed as an independent candidate, and that's what actually brought me to Kano.
Okay, sir, I don't understand what you mean by passing as an independent.
Good. From the University College Hospital Residency Training Program, I was ejected.
Oh,
yeah. If you don't pass the exam within 4 years, they reject you. They say, well, you are not fit for the program. So I was rejected. So I passed. Now, before I was rejected, I was attached to a university. Is that not true?
Yes.
After I got rejected, when you have your certificate of proficiency, you are supposed to write center of training. I didn't have any center at that time. And I begged those people that, please, let me just write this place. Even though I know you have rejected me, let me just write this place. They refused. They refused. So I just wrote independent candidate. And that was the exam I passed.
Wow, that's great. That's really motivating, sir. Um, so along the way, we tend to kind of like build mentors along the way. I don't know, sir, if there's any mentors that you have also built along the way that kept you going.
Yeah. Like I told you, my uncles introduced me to dentistry.
Yes, sir.
The first of them is Davison Oludare Lawan.
Wow.
They're twins. The second one is Jonathan Olujare Lawan. The second one I mentioned is dead.
Okay.
So Davison is alive. He's in the US presently, Howard University, Washington, D.C.
Wow. That's great, sir.
Yeah.
So now, sir, some of the things we would like to hear from you is that, sir, I would like you to share us some life-changing surgery and its impact. I'm sure you've done a lot of surgery at this moment. So what are the few memorable life-changing surgery that you have done that sometimes you reflect back to?
Yeah. Well, I've done quite a number. When you're talking about reflecting about a surgery, you have to say whether positively or negatively. I mean, I think you mean positively.
Positively.
I've done quite a lot. The outcome of surgery is what gladdens the heart of the surgeon. If the outcome is good. But when you start talking about outcome, you have to examine those outcome measures before you do that surgery, based on what the patient wants and what you want. It cannot just be what you want. We call it quality of life assessment. Yes. It has to be mainly from the patient's perspective. Okay, patient who have facial disfigurement, patient who cannot open their mouth, patient with large and horrendous tumors, that they have been carrying this thing around for a long time because nobody will touch them. Okay, I've been a part of a lot of those kind of multidisciplinary specialty care where you kind of relieve the patient of their burdens. There are too many to mention.
Yes, sir.
There are too many to mention.
Yes, sir. We appreciate, sir. Sir, you are a person that we see that you really like students to involve into innovations.
Yeah.
And this aspect of the talk, trying to like say, sir, how do you kind of like, it's kind of like an advice to students, we and the other students. How do you really see a student should look at innovation and especially this 21st century, and how could they balance it with the task too?
Yeah, thank you very much. That is a major focus of my life now. I realized I sent a patient once to Taiwan to have some kind of facial reconstruction that we could not do here. And when the patient could not go in the first place, so the state government promised they were going to sponsor the patient, thinking that it was going to be cheap. When the bill came, it was $90 million.
Wow.
Dollars.
$90 million. That's too much.
Yes. There was a patient with Cruzon syndrome with coronal cranial synostosis. Very badly mangled face. And we couldn't do, we had not started doing something like that here. Okay, so what happened was that I just thought about it. The only reason, I've been to Taiwan before. I trained at the Changung Craniofacial Center.
Wow.
Okay, in Taiwan. And I saw that a lot of their patients, they were treated free. And the reason is mainly because patients should enjoy free practice where the indigenous surgical procedures were developed.
Yeah.
They would have used a lot of patients as experiment. Some of them would have died. So once they discover the secret to this thing, why not? The money will come from outsiders like me.
Yes, sir. Yes,
so I now realize that Nigeria has everything. Nigeria has everything. If you want to start a mega specialty in this country, it should first and foremost be teaching hospitals. So that's where it started from. Teaching hospital has all the specialties.
Yes.
All the specialties.
Yes, sir.
So you should leverage on that. But I don't know why we're not there. So back to innovation now. Medical students should not wait for government to be paying them their salaries. You should prepare for that kind of life. If the salary comes as a doctor, good. But add to yourself. How do you add to yourself? Find solutions to people's problems.
Yes.
There are so many problems in Nigeria, and I see there's an opportunity to excel. In fact, to become really chief, you care. You want to have money. My case in question is these boys in Babcock, one Shola Akinlade and Ezra Olubi. You understand? I always think about them. transactional relationships online where you buy something, I'm your merchant, I give you the thing, you give me the money.
Yes, sir.
Then there's there's a barrier because it's transatlantic. We cannot exchange money by hand. Now there are lots of crooked merchants out there who are taking people's money and the goods were not being delivered. So this guy developed an app. It's called Paystax. That app was bought by government, by an institution in the US for $200 million.
Wow.
You understand? That's somebody creating a solution to a problem.
Yes.
There are so many solutions in intraoperative experiments, intraoperative practice. There's what we call reverse engineering. We may not be able to do it like the Oyibos.
Yes.
But we'll do it our way and we achieve our results, even better results if care is not taken. So this solution, if you don't solve problems, you will not be promoted, you will not be rich.
Yes.
You won't have money.
It's true, sir.
All you're going to be waiting is for government to pay you for that, and the day you go on strike, they won't pay.
Yes, it's true.
So that's what I'm saying. I wrote on a blog some time ago about professors should stop sending handouts to students to make life ends meet. Professors should be engineers, start doing things that the government of Nigeria can use. Somebody said, okay, Nigeria has started doing that. Oh, I said, hey, give me how many? Only 2. And one of them was not functional. They've taken it away from us. That TED fund.
Oh.
TED fund was by Nigerian lecturers who said, okay, fine, government, don't give us money. Don't give us money. But every company in Nigeria, foreign company, indigenous company that generate money from here should give a certain percentage of their profit to Nigerian universities. And don't remember last time. And how the problem of university funding was solved. But our government have hijacked that now. That's only one. And I couldn't see any other one. Oh, our citadel of institutions are so wonderfully gifted with highly cerebral human beings. But our situation is not allowing them to raise their head. But you raise your head, despite this, you have to raise your head. So that's my clarion call to the younger ones.
Yes.
Yeah, let's have a generational shift.
Thank you very much for that elaborative advice and also explanation of how important innovation is, especially in the medical field, which we can also see. So now this aspect is with regards to medical field in general is tasking and demanding emotionally and physically and also family aspect. So, sir, how do someone balance all these things? Because I know there's a saying they used to say that mental health is more important than physical health.
Right.
So how do we balance all those?
Well,
and I can say, sir, I've always been seeing you cheerful, which we want to know the secrets, sir.
Well, the first thing about my life is that I know God.
Wow.
I know God. And I hope you know that God is source of every knowledge, every wisdom. The secrets that are discovered today are secrets hidden by the Almighty Allah.
Yes.
You know that?
Yes, sir.
Yes. Now, if it makes you to stop believing, if you, as a scientist, you find out something that God hid, and because of that you say there's no God, that's your problem.
Yes.
But you should know that that thing you found, it was God that put it there.
Yes.
Okay,
it's true, sir.
Every wealth of wisdom and knowledge everywhere. The care for cancer is probably hidden in the depth of their own Atlantic Ocean, where there are plants, vegetation under the bed that have chemotherapeutic drugs in there that will kill cancer within 24 hours.
It's true.
It's there. Everything we need is here. We just need to discover. If you are living in a country where they have never really invested in research to find out things, if you have a disease in that line, you die. Die, and it's not God's fault. Your people didn't research. They didn't do anything. Now, God is my help here every time. I grew up to know God some more when I started failing exams. I failed once, I failed twice, I failed thrice, I failed 4 times. A lot of people had my good at heart. And luckily for me also, from my background, I've always been a jovial person. I didn't even know the kind of trouble I was involved in. Until people started telling, don't you know, if you don't pass, they'll send you out. That kind of thing. I didn't dawn on me then. I was laughing and playing around. God first, having a cheerful personality, loving the job. Love the job. I love it. Actually, when I came to northern Nigeria, where, northern Nigeria is a fantastic place. There are lots of problems and we are creating solutions. You see the smile on the faces of those mothers.
Yes, it's true.
It's amazing. No money can pay for that.
It's true, sir.
That their child who they once thought was irredeemable from this disease. Now came back like a new person. You understand? So, like I said earlier on, having a cheerful disposition from the beginning, I love God. Yeah, I pray. I pray for every one of my patients. I always tell that one of my greatest prayers is that so people have died before and I've seen them and they don't know where they died, in theater or anywhere. I say, God, that thing I don't know. Please teach me now.
That's great.
You understand? That's very important. So, cheerful disposition, loving God, loving your job. And I always tell people this job is tough. If you can't find fun in it, you won't last.
It's true.
You won't last. So that's the balance there. Don't let anything bother you. I want you to know that there's nothing that is affecting you now that has never happened to any other person before. You understand? I repeated it so many times when I was in residency. I had to keep doing that thing over and over again. But I stuck to my gun. A lot of my friends left, who were fulfilling us. But if you have a passion for the job, passion can take you farther than most things can outside of God. That's it.
So this is a great wealth of motivation, and also you've kind of like let us know that this thing, you have to really put it into yourself that you really love this and you really want to do this.
Yeah.
So sir, the next thing is we'd like you to briefly take us through maxillofacial surgery, because before we did the episode, some of the people, there was a guy in dentistry that was specifically telling me that he loves to further in maxillofacial surgery, but however, he doesn't know like what really maxillofacial surgery is all about, and how they said very few people even used to get into maxillofacial surgery. So we want some of the myths to be debunked, what's the true and what's the mistake.
Well, maxillofacial surgery is the main surgical arm of dentistry. If you know, I need to remind you, dentistry and medicine used to be together in the earlier parts of the past century, until the volume of dentistry was seen to be quite large. So they separated. The first person you know who was a dentist who ran away from medicine, like that, was a man called Vrastat Kazanjian.
Wow.
No, he went to dentistry and then he started working on the faces of American soldiers who were damaged during the Second World War. That was where reconstructive surgery came from. Okay.
Yes, sir.
You also need to learn that the fathers of modern anesthesia today were dentists, because dentistry is a profession of pain. You're pulling teeth. That was the breadbasket then.
Mm-hmm.
So you must find a way to relieve pain before you pull that teeth. So that's where local anesthesia, general anesthesia came through. Okay, so now dentistry has 5 core specialties. Okay. Oral and maxillofacial surgery used to be oral surgery, but when exposure began to extend to other parts of the face, then they added that maxillofacial. Okay, so oral and maxillofacial surgery. It's an art and science of dealing with lesions of the face, from your hairline to the point of your chin, and sometimes down below into the neck, depending on your exposure. It's a 6-year residency training program in Nigeria. After you finish your house job, you probably do youth service. Then if there is space, any center that has space will give you, if you apply in Nigeria, any center that offers oral and maxillofacial surgery. Okay, so it deals with we teach our dental students the basic foundations of diseases. We call it think and bed.
Okay.
Trauma, infection, neoplasm, congenital, acquired, metabolic, endocrine, drugs, like that. You understand?
Yes, sir.
Anything in that category, in this highlighted acronym, that can affect the human face. That's the job of the oral and maxillofacial surgeon. They're talking about trauma, road traffic crashes in the face, with impact to the face, the steering, lacerations of the skin, multiple broken bones in the face, loss of occlusion, gunshot injuries, craniofacial gunshot wounds. Okay, they're also the ones there. In infection, you have all kinds of special species of infection, because the tissues of the face and the neck, they're like layers of clothes. So there are spaces in between layers where pus can easily accumulate. You have to find your way using standard state-of-the-art imaging to find them. Neoplasm, talking about tumors.
Yes.
The common benign ameloblastoma, the common malignant squamous cell carcinoma.
Wow.
Okay, with all its attendant problems. and all the treatment with reconstruction. You can't just remove a tumor because part of that job, you have to find a way of reconstruction. We harvest bone from everywhere, from the cranium, from the iliac crest, from the rib, you take anywhere, depending on like that. Okay. So if you enter your center where you're having this, you probably spend the first 4 years doing junior residency. Okay. At which time you're supposed to pass your part one. Part one makes you a senior registrar. Okay. Where and that 4 years is going to be about all aspects of dentistry, including maxillofacial surgery. But the last 3 years is going to be solely for maxillofacial surgery. Okay. Where you're now regarded as a specialist. When they give you your certificate at National Postgraduate Medical College or Fellow of the West African Fellowship of the West African College of Surgeons, they usually add to your FMCDS of FWACS, they write oral and maxillofacial surgery. I'm one of those people that fought for that because a lot of times when we go abroad, when they see FMCDS, they say DS dental surgery, so they don't know exactly what your exposure is. So they give you roles that are quite below what you actually trained as. So I told them at National Medical College, look, it's not good that I'm an oral maxillofacial surgeon, but you are saying dental surgery. Dental surgery is at the undergraduate level. Okay, postgraduate is oral maxillofacial surgery. And they were kind enough. They said to me, okay, we'll make necessary changes when the necessary rules are going to set in place.
Okay.
So they did that, and from now on, everybody has that now. FMCDS, oral and maxillofacial surgery. So that's it. It's not difficult.
Thank you very much for clarifying the concept, because it's very clear now to us. So, sir, I think we've come to the end of the program. So I would like you to give kind of a closing remark to the audience, which they can.
Thank you. First of all, I would like to thank you guys for this opportunity. It's I saw myself on a podcast one day, but I didn't know how it was going to happen. I actually have one podcast I'm doing presently. It's called Pediatric.
Oh, wow.
Pediatric Craniofacial.
We'll check it.
Yeah, I'll show you. I've not actually started it, but I have it on online. I've not invited anybody into that. I'm just storing my. Yeah.
So I would love to also partner and work with you as your voice.
Okay. Now that you have said it, I didn't want to say anything about pediatric cranial here because that one is a team thing.
Okay.
It's a team thing. And I want you to know that even though I'm the team lead, okay, I want you to know that one of the greatest things that can spoil a group is for group members to be seeing only one person as a star.
Yes.
I don't want to portray myself. It's a team, great team, in fact. Yes. Some of the most loyal people I've ever worked with. Wow. We will talk about that later.
Yes, sir.
Okay, that's good. So I want to implore anybody who's listening to me right now, particularly the people who would like to follow in my path. I was mentored. So if you see me as your mentor, it's a great idea. Yes. I want you to know it's not tough. I want you to know you can do it. Yes. I want you to know you must have a passion. I want you to know you have to love God, because in God, when you are going through bad times, God can help. He can pull you up. Yes. Okay? And I want you to love the way. If you have all these three, the sky is the limit.
Thank you very much, sir. Thank you very much.